Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 307 of the Ask Dr. Angela podcast. It's freezing in my office, which serves as my home studio. Kind of gray, rainy outside. I've been up since about 5 a.m. I'm just not restless leg syndrome, but restless syndrome. Being in the house for, so long, being on lockdown due to COVID-19. The natives, i.e. me, my daughter, Franklin Banklin, who is our black lab mix, getting pretty restless. I have gotten my workout in for the morning, got my morning cup of joe, took the dog for a nice leisurely walk, dropped by my gym this morning to pick up a weight. It's been great doing my virtual workouts online and via Zoom. Giving a shout out to at Carbone Fitness, Christina, Ron, and of course Greg have really been holding it down through all of this. And I really appreciate the fact that you all have continued to train me. My workout is such a huge part of my life. It, is a huge stress reliever for me, and it keeps me fit, feeling good, and certainly, energized in order to do what I do on a daily basis, which is, providing patient care and being on the front lines of this pandemic. So let's jump right into today's question. I've been featuring a lot of the questions that I get in my email and inboxes on social medias because there's such a large volume between the blog posts and, responding to the emails. It's a lot of questions. So, featuring some of these on the podcast is just an easier way to get to address a lot of these. So I am still sending you an email telling you to listen to the podcast. So today's question comes to us from Lexi, and this is what Lexi has to say. What's good, Dr. Angela? I stopped the Depo shot about a year ago, and my boyfriend and I are currently wanting to have a baby. And no matter how much intercourse we have, it's almost like I can't get pregnant. I'm scared I can't have kids. I'm wanting to know what I have to do to figure out if something is keeping me from having kids. Don't you just love when people call sex intercourse? It sounds like some online class, Intercourse 101. Anyway, Lexi, this is a really great question, and certainly I'm answering this with pretty limited information, but I'm going to take a stab at it. My first question would be, how long were you on the Depo? Depro-provera, as you know, is the injectable. It's a shot. Most people get it every 11 to 13 weeks, and it is progesterone only. Depo-provera is good for people that have an issue with compliance, i.e., remembering to take something on a daily basis. A third of people on Depo-provera will have irregular bleeding. That's probably the number one cause of why people stop using it. The other kind of pro for Depo is that sometimes when people are on Depo, they won't get a period at all. And that's a bonus for some people as well. Of all the contraceptive options, Depo-provera is the one that actually can have an association with weight gain. Everyone doesn't gain weight on Depo, but I've certainly seen some people or women, gain some significant poundage on Depo-provera. Of all the things that I know about Depo-provera, with regards to this question, the thing that comes to mind is Depo-provera can take up to 18 months to get out of your system. Unlike some of the other forms of contraception, whether it be a birth control pill, IUD, etc., Depo doesn't seem to be nearly as reversible as some of the other methods that I just previously mentioned. So first and foremost, I'm curious as to how long you've been on the Depo and, you said you stopped the Depo about a year ago. Maybe you're one of these people that it, is going to take up to 18 months to get out of your system. Okay, having said that, if you have started getting regular periods again, then, the other thing to consider is, are you having ovulatory cycles? And, typically women that are getting ovulatory cycles have regular periods. They get period signs. Cramping, breast tenderness, you'll notice a change in your discharge, etc. So that would be my second question, how are your periods? But anyway, my next question to you is really about your period history and whether or not you're getting ovulatory cycles. If you are, then the other question would be really history. Do you have any history of things that might be occluding your fallopian tubes, endometriosis, any history of any sexually transmitted infections like gonorrhea or chlamydia? These are things that could potentially block the fallopian tube. So, I would say that if you've been trying for more than a year to get pregnant and you've not had any success and you're having regular periods, probably you will need to see a specialist. In my patients that have been trying for a year and have not had any success, I typically do send them to see my friends that are REIs, or reproductive endocrinology and infertility specialists, i.e. the people that help folks get pregnant. And they can do a workup, which typically will consist of some blood work to check ovarian function, usually an ultrasound to evaluate uterus and ovaries. There's another test called a hysterosalpingogram, which is typically done to check the patency of the fallopian tubes, just to make sure that there's no issue with, the fallopian tube grabbing the egg and having the egg be transported through the fallopian tube and into the uterus. Having said all of those things, Lexi, the other thing to note is that, if you're having a regular period and, everything else that I discussed doesn't apply to you, maybe it's not you at all. One of the things that people tend to forget is that about 30% of infertility is due to male factor, i.e. it might not be you at all. So certainly as part of the fertility workup, men are part of the equation and typically will minimally get a sperm or a semen analysis done. So, Lexi, hopefully this sheds a little bit of insight and hopefully this addresses your question. Thank you so much again for submitting it, and good luck, good luck, good luck. Keep me and us posted. Thank you all so much for tuning in to today's episode of the Ask Dr. Angela podcast. I'm hoping that you got something out of it. What else? If you are not a subscriber, please check me out on www.askdrangela.com. That's ASKDRANGELA.com. There you can sign up for my weekly blog post, my podcast. You can follow me on all of my social media channels, i.e. Twitter, Instagram, and Facebook. I so appreciate all of your continued support. Let me wrap it up with another inspiring quote from, one of my favorite books, Congratulations, Graduate. Again, I think I got this book when I was graduating from high school. And this is what today's quote says: the more you study, the more you get paid. This is actually something that I tell my mini all the time. And Charles Kendall Adams says, no one ever attains very eminent success by simply doing what is required of him or her. It is the amount and excellence of what is over and beyond the required that determines the greatness of ultimate distinction. It's going the extra mile. Until next time, choose happiness.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.